The weather, wow, making people want to get active, be it running, hiking, playing soccer, whatever your pleasure. It most likely involves your knees, and that's where Dr. Trevor Trin comes in. Dr. Trin is a sport medicine specialist here to talk about common knee injuries and why Dr. Google may not be the best solution to answers. Dr. Trin, thank you so much for coming in.
Thanks for having me.
And I guess right off the get-go, what are the common injuries that you'll see this time of year? Is it like overuse, or is it actual kind of people being hurt playing soccer? What is it?
Oh yeah, most definitely. I like to look at knee injuries in two ways. There's the acute traumatic type of knee injuries, and there's the overuse chronic type of knee injuries. In regards to acute traumatic knee injuries, there would be things like, in regards to structure here,
okay.
Injuries to, say, like the ligaments within the knee, which are the structures that hold the bones together.
So that's at the side of the knee,
yeah,
right?
on the side,
okay, yeah, okay.
and also on the inside as well.
Oh,
but people can also get injuries to the meniscus, which is the soft, shock-absorbing cartilage within the knee. And these can happen from some sort of plant pivot twisting movement, where it overstresses the structures within the knee, causing pain.
Well, I'm thinking if someone maybe goes and plants their leg kicking, playing soccer, for example, right? That's one? Okay,
Most definitely. And on the flip side, there's the chronic overuse types of injuries where people can develop pain from, say, the kneecap not tracking around the kneecap properly, causing patellofemoral pain. Or by far the most common types of knee injuries or pain that we see in our clinic is osteoarthritis. Osteoarthritis is a wear and tear of the knee joint where people can develop pain just from advancing age or just degeneration within the knee joint, resulting in pain.
Sure. And the acute traumatic one, that's going to be a sharp, like being poked with a knife type thing, as opposed to just an ache?
Most definitely.
Okay.
Yeah, most definitely.
Okay. And is there one sport over another or one activity over another that leads to more knee injuries? Or?
Yeah, certainly. I find that a lot of people who do contact collision type of sports like rugby, football, wrestling can develop a lot of injuries to the ligaments in the meniscus. Sports also like skiing, soccer, which involve a lot of plant pivot twisting, also can result in a lot of meniscus and ligament injuries. But again, like a lot of people also develop some overuse injuries, like runners can develop patellofemoral pain.
Sure.
Jumpers, like volleyball players and basketball players, can develop patellar tendon pain. So it really depends on what type of sport that they do.
Okay, and I mean, the first thing that people do these days is when something happens, they jump on Google, right? And they try and research it, which is good because people want to get educated, but it may not be the best thing in this case, right?
Oh, for sure. We oftentimes tell people that it's very easy to get information off the internet, but it's really the quality of the online information can be quite variable. I oftentimes tell people to question and to be cautious in regards to looking online for information, just because it's hard to say how accurate that information is. At the end of the day, just making sure that the information is from a reputable source, and that when in doubt, seek advice from a trained medical professional.
And a lot of times it doesn't necessarily involve surgery or MRIs or that type of thing, right?
Oh, for sure. I mean, the two misconceptions that we oftentimes hear is a lot of people feel that they need an MRI to get the diagnosis, but that's oftentimes not the case. And what can happen is it actually delays their treatment and their diagnosis, because a good physical exam and a good visit from a trained medical professional can be sufficient. On the flip side, some people also feel that they need to see an orthopedic surgeon for knee pain, and that may not be the case as well. I mean, it's really sad for me to see patients who've been on a wait list for months, if not years, to see a surgeon for a condition that may not even be surgical.
Okay.
And in those instances, oftentimes all they may need is just a good physiotherapy program.
There you go. Yeah, I mean, that's awesome. If that's all you need, that's great. If you have questions for people like Dr. Trin or his colleagues, there's an information session happening at the University of Calgary coming up. It's on Monday. Breaking myths about knee pain. It's at U of C, room KNB 132, this Monday, April 30th, from 7 till 9 p.m. And come out with questions. Get educated, right? That's the whole point.
Exactly.
To kind of know your knee and know what's serious and what's not. I love it. Good. Nice
Great.
to meet you. Thank you so much, Dr.
Thanks, Ted.
Trin. Appreciate it.